Hi and welcome to the Bart's Cardiovascular Simulation Lab. I'm Dr. Khalid Barakat. I'm clinical lead for simulation at Bart's. And today what we're going to do is to look at some specific things about intra-aortic balloon pump insertion. They're becoming less frequent, and as a result people are becoming de-skilled, particularly with certain aspects of the procedure. So what I'd like to do is just to remind people what comes in an intra-aortic balloon pump kit. I'd like to explain how to prep it and where things can go wrong, how to secure the balloon pump and how to connect it to a balloon pump machine, how to connect the catheter. So when we ask for an intra-aortic balloon pump, just as a reminder, it's important to size it, and the sizing is written on the side of the packet. You'll see a round circle which tells you how many cc's the balloon is, 40 cc's in this case, and the blue will then highlight which patient it's appropriate for, and the appropriateness is determined by the height of the patient, because what we're trying to do is to make sure that the balloon element of the balloon catheter is below the subclavian and above the renal arteries. Okay, so if we open one of these boxes, what we'll find is an instruction manual, which is quite useful to read prior to doing one of these procedures. And then there are 4 individual packet inserts within this box. First one here essentially has the intra-aortic balloon pump. And we'll talk a bit more about that in detail in a second. The next big packet here has everything that's required for vascular access on this side via Seldinger technique. 2 manometer pressure lines, which are now historical, and a helium pipe. And then the other 2 packets have fixation kits for fixing the balloon catheter in place. So if we have a look at the content in this particular part of the box, it's got a plastic cover to stop everything falling out, so that comes off first. On this side we've got everything that we require for vascular access, as I've said previously. We've got a Cox needle here, which everyone who does these procedures will be familiar with. We've got a J-tip guide wire, and we've got 2 dilator sheaths, and then we've got a sheath for insertion. So you can choose to get into the vessel with your wire, with your needle, introduce your guide wire, dilate up the tract, and then you can either go for a sheathless insertion or put a sheath in, so it's entirely up to you. With these sheaths, they're exactly like the same as all the hemostatic sheaths that we use in a cath lab, so they have a hemostatic valve which allows insertion of devices through them, but won't allow blood to come back. So the preparation for this is exactly the same. You have the bigger introducer introduced into that and ready, and this is for dilating up the tract initially with the J-tip guide wire there. We've also got a 3-way tap, which you would use if you were using manometry, with these 2 pressure lines. And then we've got a big bit of tubing here for the helium. You'll notice, for those that are familiar with these balloon pumps, that the tubing here also has these blue clips which weren't present previously. And if you take a closer look at these, the reason that they're there is to allow the cable from the pressure transducer to be clipped along with that cable to keep everything neat and tidy. And again, we'll look at that a bit later. So the other insert has the balloon pump catheter in it. And actually, very helpfully, if I turn it round, it's actually got a 3-step guide to how to introduce, how to prep the balloon. And there have been some issues that we've come across because this procedure is done so infrequently that we just need to clarify. So there's a cover on top of this end of the insert packet to stop all this stuff falling out. So to recap here, we have got the balloon pump catheter here. This blue section here is called the T-bar, and it's there to protect the intra-aortic balloon, which I'll show you a bit later. We've got a central lumen here, which connects with a hole at the distal tip of the balloon, which allows the J-tip guide wire to go down this balloon, allow insertion of this into the aorta. And then we've got the helium pressure line here, which is connected to the balloon, obviously. Now this 30 ml syringe comes connected to this device, and this device is a pressure valve, a one-way valve to stop air going back into the balloon. So it's designed to allow preparation of the balloon. Now, the prep of the balloon and removing it from the T-bar should be the very last thing that you do before you insert the balloon pump. But just to demonstrate how we prep these things, this valve allows air to come in that way, but if you try and go the other way, it won't go. So it's a one-way valve. It's really important to reiterate that, because there has been some confusion as to what the role of this thing is. It's connected to the end of the helium line, which is connected to the balloon. And the aim of this is to take out any residual air to create a vacuum within that balloon to try and get the profile of that balloon as low as possible. I've seen people do all kinds of things with this. I've seen them pull the plunger out. There's no need to do that. You just need to slowly come back with this, and then you can release it. The air is not going back in here because this is a one-way valve. Then obviously, because this is a one-way valve and you're trying to maintain a vacuum within that balloon to try and keep it as low profile as possible so you don't damage it to facilitate insertion, you then just can disconnect the syringe, leaving that one-way valve in place. Now, believe it or not, I've seen people take these off, and if you do that, you'll hear a little hiss of air rushing back in. So that's not the thing to do. So the important thing here is that this valve is used to prep the balloon, and the one-way valve has got to stay there until the balloon has been inserted past the sheath into the aorta. So the next thing really is the final step of preparing this balloon, and this should only be done right at the last minute when everything is in place ready to insert this balloon. It's very important to handle this balloon very carefully. They're very delicate and easy to kink. If you kink one of these things, then there will be issues with balloon inflation and the alarm will keep triggering. So the way to take it out is to just bring it out. We've already prepped the balloon using the one-way valve. We've aspirated as much as we can slowly, and we've kept the one-way valve in place. And the reason we've done that is to keep the balloon as low profile as possible. It comes already pre-packaged in the T-bar, and you can see there are 3 different segments in the T-bar here, all designed, which are tubes, all designed to keep this balloon as low profile as possible. The final step in that is to create a vacuum with this one-way valve, which needs to remain in place until the balloon's been inserted. So I'm sorry to keep hammering on about the one-way valve, but often that doesn't happen, and as a result people struggle with getting this balloon in and damage the balloon. The final step before we insert this balloon is to take the balloon pump catheter out of the T-bar, and there's a way of doing this. The way not to do it is to pull it like this, so you're shearing the balloon. You've got to get hold of the T-bar at the end and get an assistant to help you stabilize the other end of the catheter, and then you pull it off in one clean movement so your balloon comes out nice and neat. That is now ready to insert, and all the time if you delay this, then there's a chance that the profile of this balloon will continue to increase. So the aim is to try and do this at the last minute when you're ready to insert. You can feed the wire onto the distal tip of the catheter, which will come out of this port here. We've decided to, on this simulated model, to go for, now man, if you follow me, to go for a sheathed approach. So we'll bring the wire back until the wire appears, and there it is. Amanda, could you now hold the wire for me? And we will now insert the balloon. Holding the wire? Great. And again, the exercise with this particular teaching video is not to show you how to insert one of these, because this is essentially a catheter. But these catheters, if sized appropriately, are designed to sit just below the subclavian and above the renal arteries. So if you did a fluoroscopic image, you'd be aiming for the tip to be at the level of the carina. Okay, so now that you've got the balloon in, at this point we can take the wire out. And when we do that, we should see blood coming back through that central port. If we don't, then it's a good idea just to aspirate some blood back, and once you've got blood back, we can then just cap it. In the old days we would have used this for manometry and blood pressure, for aortic pressure management, transducer pressure measurement, but now we use this pressure transducer line instead. At this point, the one-way valve you can take off quite safely, and you can hear that little hiss at the end as the air just rushes in. So what we will now do is to go on and connect the different lines. So this is for the helium pressure balloon, and you can see they've got a male and a female. So the female on this side goes to the male connector on this side. We're now at a stage where we can hand the pressure line over to an assistant to plug into the machine. So that goes through there to that centre and is then pushed firmly into place. The electronic pressure line is then disconnected and moved across. It has a little cover on it for protection, which we can take off. It's got a red arrow, which corresponds to a red arrow at the top of the machine, and there's a cover into which is displaced, and this can be then inserted. So I'll hand that to my assistant. Okay, so the plug is simple, straightforward. The cap's already been taken off. There's a red triangle at the top, which corresponds to the red triangle up here, so you know which way around it goes. If you look at it, you can see it's a D shape at the top and flat at the bottom. And if you pull that across, you can see the same shape there, so that corresponds with the red triangle. Helpfully on the machine, they show you the plug with the wire coming out, which is orange. Now, some issues can arise when trying to insert this thing. There might be a tendency to try and put it in like this, and people struggle. If we turn this around, you can see that there's an angle to this plate, and so it does go in orthogonally to that plate, but it means it's diving downwards. And as soon as it goes in, you hear a click. Okay, so now that we've got the balloon pump connected, the balloon's in, it's just tidying up these wires. So helpfully, they have these little clips on the tubing itself, which is designed to allow you to clip the wire to keep it nice and tidy. Otherwise, you will have issues with people pulling these balloons out. So it's important to get that all secure and in place, and your assistant can go and connect the other two. We've got the two major connections into the module. The next issue can be trying to find the on-off switch, and it's hidden behind this handle. It's just here, and you can see that the familiar on-off switch symbol, and you just press that and it comes on. So now this bit is just to show you how to fix the intra-aortic balloon pump. So it's in the sheath, and you can see that there's a distance between the sterile sheath cover and the access sheath that we have. So the next thing to do is to advance that cover over so that it comes into the sheath itself. We're now ready to fix this catheter, and it'll be fixed at 2 points. One is here and the other is here. Unfortunately, this simulation model is quite short, so usually the gap between these two is a bit longer. Inside the intra-aortic balloon pump kit, you will find two packets that look like this, and inside there is a preparation pad, which is just an alcohol wipe basically, a bit of a sticky plaster that looks like that, and one of these adhesive devices which is designed to anchor the catheter. So we clean. I would suggest that this area is first cleaned with a wet swab to get rid of any blood and obvious grime that you can see, then dried, and then an alcohol wipe is used to properly degrease the area so that you get maximum adhesion from one of these pads. So once the skin's prepped and ready, we can take one of the adhesive pads, we bring it across, get the studs in place, bring the butterfly wings across and lock it secure. So once that's secure, we can then undo the sticky, stick it down, and again remove the backing paper and stick it down. Okay, so thank you for listening to this video. Just to recap the important learning points, and it's all to do with preparation of the balloon pump. So the balloon pump comes with a one-way valve and a 30 ml syringe, which can only be connected one way. This is then connected to the male end of the helium tubing just before the catheter is removed and inserted. 30 ml or a certain amount is slowly aspirated back into the syringe, and then the one-way valve is left on the intra-aortic balloon pump prior to insertion to keep the profile of the balloon as low as possible. When the balloon pump is taken out, the T-bar is the thing that keeps the balloon itself secure and safe, and it's important to pull the balloon off in a straight line so there's no shearing of the balloon. That's handed to the operator, and then that's inserted. The one-way valve on the end of the intra-aortic balloon pump should not be taken off until the balloon is inside the aorta. Thank you very much for listening, and I hope this has been useful.